Very good morning. I would like to share many facets of pediatrics. And first I would like to talk about various types of the rashes in pediatrics. So I will show you, there are various terminologies of the pediatric rashes. One is a macule, which is very flat surface, well circumcised and very just change in the color. Second one is the papule, which is a small elevated lesion, and nodule is little larger, solid and elevated lesion. Plaque is the lesion that slightly raised over the area, and blister is which is a fluid filled lesion. Ulcer is depressed lesion, that is with the loss of the surface epithelium, and atrophy is also depressed lesion, but the surface epithelium is very intact. And crust is the mixture of the scale and serum. Petechiae is non-raised small reddish brown patches which is seen in dengue fever. There are various types of the rashes can be seen in various diseases, like the maculopapular rash is seen in measles, vesicles are seen in chickenpox, and the crust seen in the impetigo. This is typical slide of the chickenpox, in which there is central depressed area and surrounded reddish erythema. Macule, papule, crust, they appear at the same time in this lesion, and chickenpox is caused by the virus varicella zoster, and usually it occurs in the April, and this is typically initially starts on the trunk, then it spreads to the extremities, and line of the treatment is calamine lotion, Calatril lotion, and paracetamol, antipruritic agents we can apply, and main complication is chickenpox encephalopathy, which is very dangerous. This is the picture of impetigo, in which there is a crust like lesion and surrounded by the red erythematous margin. It contains the yellowish serous fluid, and after that when it dries it becomes crust, and line of the treatment is Bactroban, and orally we are giving flucloxacillin, erythromycin, azithromycin. Usually Staphylococcus and Streptococcus are the causative organism for that. Mucous membrane is involved, oral mucosa and conjunctivitis are the signs, and there is central disformation and necrosis. This is drug reactions, Stevens-Johnson syndromes, and this is typically occur in sulfonamides, rifampicin, lametrogen, anticonvulsant agents, brufen, ibuprofen, profen, and usually mucous membrane involvement is there. Infective may be seen in herpes simplex. Hello. This is typical scabies, in which there is pruritic lesions all over the body, and pathognomic feature is that there is itching at the night and whole family start itching, and organism is Sarcoptes scabi or mites, that is transmitted through the towels, beds and the napkins. We have to wash in the washing machine above the 50 degrees Celsius, and we have to apply permethrin lotion or benzyl benzoate whole night for 3 days, and then again repeat after 1 week. If it is less than 2 months, then 5% sulfur ointment we have to apply. This is small marbiliform rash and very small rash, maculopapular, and that is mixing with each other. Usually starts over the face and then it comes down, face and the neck it starts, and then trunk and then extremities get involved. Usually it occurs in the summer season, and this is measles. Measles from the paramyxovirus family, and usually that is we can prevent with the measles vaccine. And antipruritic drugs like the Atarax can be given, and to apply calamine lotion we are using. Along with that, vitamin A we are using. Typical features of this is cough, coryza and conjunctivitis, 3C we have to remember, and we can see coplic spots just in front of first molar. This is classical slap chick appearance. This is fifth disease by the paramyxovirus B19. Usually perioral area and periorbital area is paired, then that rash appears to the trunk and then the extremities, and usually this is very fatal in pregnant women because fetal hydros fetalis and fetal loss are the many features. It is usually self-limiting. This is a case of contact dermatitis, in which the feces and urine that is come in contact with the skin when the diaper remains for prolonged time, and it causes the desquamation of the skin. Usually the fungal infection is very common, in which the satellite lesions we can see. And that fluconazole gel we are applying, and absorb powder, that is chlorotrimazole powder. And frequent diaper changes and barrier cream like the zinc oxide and castor oil we have to apply with the hydrocortisone 1%, steroid and nystatin 20%. Seborrheic dermatitis is the same condition in which the intertracheous area is usually spared. This is typical round lesion of the scalp, that is round lesion or capitis, tinea capitis, that is caused by the fungus dermatophyte, and we have to apply antifungal agent, and orally we have to take the griseofulvin for the 6 weeks, 10 milligram per kg. This is small blackish necrotizing lesions seen over the extremities and all over the body. Patient is very toxic. This is the rash of the meningococcal meningitis. And main causative organism is Neisseria meningitis, and cefotaxime is the drug of choice. We have to treat systematically and systemically. This is the small and very hard lesion. These are the warts or the infectious mononucleosis or molluscum contagiosum. It contains viral. It is because of direct inoculation of the pox virus. We have to cure it with the sharp curate, and liquid nitrogen is applied for the 2 to 3 weeks. This is small and reddish, very small rash, and that is called miliaria rubra. This is because of excessive sweating during the hot season, and only line of the treatment which we have to create humidity and air conditioning and apply some emollient like the calamine lotion. This is the typical feature of the Kawasaki disease, in which there is a strawberry red tongue. Usually features are like the scarlet fever, mucosal involvement is more. Only the differentiating feature is cervical lymphadenopathy and coronary artery aneurysm, which we can diagnose echocardiographically. And if the fever lasts more than the 5 days, child is very irritable, strawberry red face, and it's like the Kawasaki motorcycle. When the person rushes very fast, then redness of the eyes occurs and discommission of the hands and the feet occurs. The name given by the Kawasaki because it is type of the vasculitis and discovered by the Kawasaki. And the line of the treatment is give the aspirin for the 80 to 100 milligram till the fever subsides or more than 14 days, and then taper it up to the 3 to 5 milligram per kg per day for 6 to 8 weeks, and intravenous immunoglobulin 2 gram per kg per day. Thank you very much for giving me opportunity for expressing myself on YouTube.